I'm Tan Maw Pin. I'm an academic geriatrician based in Kuala Lumpur, and I work at the University of Malaya. Dementia is a common condition amongst older people. And unfortunately, as the population of the world ages, the prevalence of dementia is likely to increase. And this increase is actually occurring the fastest in developing nations, which is now just aging compared to developed nations, which have already aged. Therefore, we need increasing abilities to actually diagnose dementia in resource-poor settings. At the moment, we are challenged by lack of awareness amongst people of dementia, that dementia is actually not a normal condition for aging, but that this is a pathological condition that if diagnosed early can even be potentially reversible. So therefore, individuals who look after older persons or the older persons themselves rarely present with dementia early on and often only come to see a doctor when their symptoms become troublesome or they are no longer able to actually provide for themselves by actually addressing their own activities of daily living. So there are issues with diagnosis in terms of diagnostic tools as well. We lack adequate translations for languages that developing countries use. And also, a lot of the tools are not culturally sensitive and requires the ability to read and write. So we do need better tools that are not educationally or culturally biased that can be used in developing nations. The diagnosis of dementia requires that the person living with dementia actually has functional impairment. The definition of functional impairment itself can be very challenging in a developing nation setting. So older adults rarely live alone. They live in extended family units, and it is actually an act of filial piety to actually do things for the elder. Therefore, when they lose ability, it is not very clear whether it's because someone else has taken over the task out of respect for the elder, or whether they've genuinely lost ability due to dementia. Therefore, we almost need different definitions for dementia for developing nations, one that does not rely solely on activities of daily living, but also exploring functions of that older person in society. Until all these issues are addressed, developing nations face a huge problem in trying to address the increasing burden of care for people living with dementia as their populations age.